Christina. I'll be relatively informal because I know you've had a lot of formalities in all the various conferences and events. Just a quick show of hands. How many of you were at COP in Dubai last year? If you were, just put up your hand. Oh, I'm surprised it's the minority. So last year at COP, 100,000 people showed up. And for those of you who were there, right, it was almost as though there were two parallel negotiations. There were conversations where the government negotiators were, right, negotiating, and this was actually the smaller group. And then there was the rest: business, civil society, academia, many people who are very interested to either tell people what they're doing so that they can generate more support and business, hopefully, for themselves, or they're interested to just get a pulse on where things are. But the good news is that the momentum is there, right? So this year, one of the most often questions that I'm asked is, would the election cycles in all the various geographies actually derail the climate and nature momentum? And I'm optimistic, and that's shared by many people that we've spoken to, which is that they feel that the momentum is there, right? Yes, the politics may actually mean that the agenda gets manifested in a different way, but it is with us, the climate challenge is with us, and that there is enough resolve and awareness for that efforts to continue to move forward. Obviously, the challenge is, can we actually move faster? Can we organize ourselves better? This conversation on climate and health is also very timely because actually it was one of the first times last year at COP where it was actually very much on the forefront of the agenda, right? Because for a long time, people were talking about E and not really thinking enough about the S, but actually E and S are together, right? Because it's not about saving Mother Earth, it's actually saving ourselves. And if we are not quick enough in dealing with this crisis, we could actually be confronted with a very massive humanitarian disaster, right? I don't want to go down the doomsday route because today is really around how we can bring forward the solutions, which in many instances it exists, but really how do we help to connect the dots? So I actually want to share 3 connecting the dots ideas that you might want to think about in your conversations forward. One is the idea of connecting geopolitics and trade, technology changes, social issues, inclusion, diversity issues with the climate agenda, right? You can't talk about them in silo. They're all going to impact each other, right? And there are opportunities in that setup, right? And I'm very heartened that today we also have people who are experts in climate and AI, right? How can AI actually be deployed as a force for good for the climate agenda? The second set of dots that I would like you to think about is really also the reason why we're all meeting in Singapore is the whole public-private philanthropic construct, right? Just 2 years ago, we took a look at the percentage of giving of philanthropists to climate agenda, and it was just 2%. And this was research done by Climate Works, right? 2% of global giving was going into climate mitigation efforts. And we were like, wow, that's a lot of possibility to up this number, but also to grow the pie, right? And so that was one objective of GAEA. How do we actually encourage more people to think systematically about climate when they are actually engaged in their philanthropic efforts? But the second objective of GAEA is really to think about systems change. So you don't just drop the dollar and move on, right? But you actually think about, can philanthropic capital be used as a catalytic force, right? I think some of you who were at the plenary yesterday where Tony Black spoke, he actually said, look, the best philanthropy is a philanthropy that will, where the effort still remains, even though the money has gone away. Right? So it's actually not a permanent crutch, and we all know this. It's much better to teach a man how to fish than to give the fish on a persistent basis. So the public-private philanthropic effort is really how can we actually connect the dots between what philanthropists are doing, get more of them to do this, do climate and nature, but also get them to link into the public and private action that's already gaining good momentum forward. The third set of dots that I want you to think about is really where this topic sits today, right, which is the connection between carbon emissions, which we're all very familiar with nature, with water, right? I know I'm preaching to many of you who are experts in the space, right? But also to link this to the people humanitarian agenda, right? And this is something that is not just about the underprivileged. This is not about the developing, emerging economies, the have-nots, but it's about all of us, right? Because the climate emergency or the climate developments will actually affect each and every one of us. One of my colleagues just went to Brazil to his family farm, and he was telling me that the temperature was at 60 degrees Celsius. Unimaginable, right? I took a short holiday 1 month ago in Sulawesi, and there was already coral bleaching. And the scientists did warn, once you get to 1.5, the corals are going to die at massive scale. I'm not going to go down this doomsday scenario, but I think having awareness and for us to be sufficiently aware and alert will also be in a way to inspire greater action, creativity, innovation in the space. So today we're going to talk about climate and health, but don't forget all the other dots, how climate is connected to nature, water, and many a time, if we get it right, you can actually reverse that cycle from a vicious loop. You can actually create a virtuous cycle. If you actually get your water story right, you can likely also solve your biodiversity challenge and also likely be able to improve the carbon cycles and create better jobs, better lives for ourselves and for future generations to come. So on that note, thank you all for being here. I know you have many options. First, thank you for coming. Many of you flew down and battled jet lag to be here in Singapore. And also amongst all the sessions, thank you for being here. And I hope that you can all have a very fruitful conversation, as well as to meet each other and make some meaningful connections and to connect the dots, because each one of us carry at least 1 or 2 dots, right, which we can actually plug into the broader ecosystem. So thank you. Christina, back to you.
Thank you so much, Jingwei.
Thanks so much, everyone, for being here. I'm really excited to be moderating this excellent group of speakers today. A little bit of context, I'm with the Wellcome Trust. We're strategic partners of the World Economic Forum on the Climate and Health Programme, and we're also members of the PAA, so really delighted to be able to facilitate this conversation. What we'll be looking at today, we'll have 2 expert panels, which I'm excited by, and we'll be looking at what is the research telling us, what are we learning about the climate and health nexus, how can that inform what action we take as philanthropies, and what is happening now in terms of strategies and approaches that can help all of us as we continue or embark on our climate and health journeys in our respective parts of the PPP universe. So with that, I will start by turning to Alan. We'd love to hear from you, Alan, on what are we learning? What is the research telling us about the impacts on health of climate change?
Well, thank you very much, and delightful to be here today. Thank you. So at Wellcome, what we're trying to do is we want to transform the evidence base on the links between climate change and health. And that's because we want to put health very much at the heart of climate action, driving the evidence, generating the evidence to ensure that climate actions are there to protect human health. And I don't need to tell you that at the moment we are in the midst of a really catastrophic crisis, and I'm going to be careful about going down the doom path, but we need to hear some of this. And you will know that last year the World Meteorological Office produced a report which said that the climate was now off the charts in the state of where we are. And just last week, NASA said that we were now in uncharted territory. So the temperatures are so high now, we are in uncharted territory. So many of the discussions we've had to date have been really related to temperature and related to carbon dioxide emissions. And if you go to COP, that's the majority of the discussions. We've got to keep below 1.5, we've got to cut our emissions. But the reality, of course, is that climate change is being felt by us, by humans on the planet, and the impacts are already large and are going to be enormous. And the generation of that impact evidence is what we are really here to do, we as Wellcome are here to do, is generating the evidence, but not just evidence for its own sake, but evidence which can drive policy action. And one of the tools we have to do that is we support something called the Lancet Countdown. The Lancet Countdown is an annual report which looks at over 40 different variables, indicators of the impact of climate change on health. And I'm just going to pull out some of the statistics from that with relation to Asia. So Asia is now among the world regions which has got the largest number of days with health-threatening high temperatures. So you will know that temperatures are growing around the world, but those impacts are felt disproportionately in different parts of the world, unequally in different parts of the world. And Asia has the highest is amongst the region of the world with the highest numbers of high temperature days. And we know that high temperature leads to increased morbidity and mortality. And in fact, that mortality in the over 65s has risen by 85% over the last 20 years. That excess mortality caused by extreme heat. We also know, so high temperatures are one thing, but high temperatures also affect our ability to work. And we know that that therefore has an impact on GDP. And in Asia, nearly 25 days a year per worker are potentially lost due to high temperatures. That has a tremendous impact on livelihoods of the worker, therefore, you know, the socioeconomic status of that person and their family, but also more broadly. And the estimates are that it's equivalent to $860 billion of lost income in 2022 alone, which is up to 6% of GDP in low-income countries. So the heat has an impact on our health and our risk of death, but also, therefore, through to productivity and GDP. Asia is also a major part of the world where drought is increasingly common. And Oceania has experienced, 55% of Oceania has experienced extreme drought over the past 10 years. And of course, this has unbelievable impacts on food security. So many low-middle-income countries dependent on generating food themselves and smallholder farmers. And in drought conditions, it's of course impossible to grow food. And it also seems that the disease vectors very much enjoy this changing climate. And you will have seen here, of course, huge impacts of dengue, the spread of vector-borne diseases such as dengue, but also waterborne diseases. And Asia is the part of the planet with the largest proportion of the population which lives within 1 meter of sea level. So small rises in sea level, which are now, of course, happening because of glacial melts and other things, result in increased sea level rise and increased risk of flooding. And, of course, that brings with it waterborne diseases, and many bacteria, like the Vibrio species, are spreading significantly around, especially in Asia. So those are the things. So we know quite a lot already about the impacts, but there's tons we don't know. So we don't know about the impacts of climate change on mental health. We don't know about the impacts of climate change on maternal and child health. We don't, many areas where there's still a lot of research to be done. And that's what we're here to do. We are here to generate the research that will help us understand the impacts. And once we understand the impacts, we can start planning for the adaptation actions. But most importantly, once we understand the impacts, we can also drive the mitigation narrative. It is imperative that we mitigate against climate change. We reduce greenhouse gas emissions in all the ways we possibly can.
Thank you, Alan. We'll come back to you in terms of some of the strategies and approaches that Wellcome's taking. But I think next we'd love to hear from you, Aaron Abda. We've heard about what's happening in the world, how this is showing up in Asia. I would love to hear a little bit more about your organization and the way that you're approaching collaboration, including the collaboration with the Clean Air Fund, which I think many people here would be interested to hear more about.
Sure, thank you. Good afternoon, and great to be here. As a way of introduction, I represent the Council on Energy, Environment and Water. We are listed among the 20 best climate think tanks in the world. And our objective is to use data, our multidisciplinary analysis, and our strategic outreach to make a difference in policy and in action. So when we look at the climate and health nexus, I really liked Gim Hui's nudge to all of us about connecting various different dots. Because these are sectoral dots, these are dots that have to be connected across different scales of governance. So the way we look at it is at least 3 areas. One is extreme weather and how that is impacting the threat to lives. The second is heat stress, and the third is air quality. And let me just illustrate these with some examples of the kind of work we've been doing and the kind of partnerships we've been exploring. Let's start with extreme weather. We don't have, across the developing world, hyper-local assessments of climate risk. So what CEW set out to do was develop the first high-resolution climate risk and resilience atlas for India, which is at a district and now at a sub-district level we're trying to do. We know that over the last 5 decades, we now have 3/4 of our districts that are now hotspots for extreme climate events. But when it comes to the health connection, we see that while we made a lot of progress in supporting and giving early warning coverage to the cyclone-affected population, only 1/3 of the flood-affected population is covered with early warnings. So that's where we are now working very closely with the Met Department, with state governments, et cetera, to see how that can be scaled up. The second is heat. This summer, India is expected to have 20 days of extreme heat. The average is usually 4 to 5 days. Now, you already see on the back of 10 straight months of the hottest temperatures ever, how are you going to prevent the loss of lives and prevent this major public health challenge? So in India, for the last few years, about a decade or so, several cities, about 100-odd cities, have come up with heat action plans. But what's missing in those heat action plans is that, firstly, they're only about heat and not humidity. And secondly, they're at city level. So we've just finished for a city in Maharashtra called Thane, the first heat cum humidity heat action plan, but at a ward level, neighborhood by neighborhood. That allows you to get a much better sense of the exposure and the sensitivity of the population there. It could be a poorer neighborhood where there might be construction workers versus a richer neighborhood where they might have air conditioning. So when you do it ward by ward, your public health intervention becomes more precise. And now we are trying to develop a methodology whereby you don't go city by city for the 8,000 cities you have in India, but you work with the state and central governments, and you try and develop a tool, an analytical tool that helps you create these heat action plans in a much more automated way. Finally, air quality. India, you all know, it has the dubious distinction of way too many cities among the top 50 in the world, which are highly polluted. But here's the problem. The problem is not just that air pollution is there and it's coming from various different sources. We haven't changed the narrative. The narrative is still about air pollution as a liability. And what we're trying to look at is how can clean air become an asset. So with the Clean Air Fund, Jane Burston and I initially co-chaired the first GFC of the World Economic Forum on clean air. And then last year, we co-convened something called Our Common Air. It's a global commission co-chaired by former Prime Minister Helen Clark and the former chief scientist of the WHO, Soumya Swaminathan. We got 18 commissioners from 12 countries focusing on a change in this narrative. Clean air as an asset, new financing models. In fact, I'm going straight from here to the World Bank Spring meetings, where I expect to kind of raise this issue, and I think we'll hear a lot from the World Bank in a few weeks and months. Have the bespoke solutions and have a clear accountability framework. In all of this, the attempts that we are making is how do you connect the local, the dot connecting, local clean air is often thought of at the local level, but with how do you connect it to global solidarity, because air is part of the global commons. And the other is, if it is killing 7 million people across the world, then why doesn't it get the same attention as climate does? And when we start connecting those dots, climate, health, and the economy becomes a different way to present the narrative than we've done so far.
Thank you. Really important perspectives there, and starting to tap into, how we're working at that government level also. That initiative was announced at COP28, and Liz, so was the announcement from Rockefeller that you'd be investing $100 million in climate and health. I'd love you to talk a little bit more about that, and also about the guiding principles on financing climate and health, which you've been so instrumental in developing and bringing to the world, and really to talk about how that can be an enabler for philanthropies and other actors moving into the space.
Happy to, and thank you again for having me here. I think one of the things that's really exciting to me about this panel right now is we are partnered with all of you in very different ways, and I think many of you in the room as well. I know one of our grantees from Ask Health is here, who is working with us on better understanding this field, and it's exciting to think, Kim-Hui, you asked me the question yesterday, like, what would you see in a year? If you asked me last year, I would hope that health would be on the agenda for climate, and this was such a huge win at the COP this year that happened. And I think it's important to recognize that because it's finally getting the focus it needs. And that's why, Szilagyi, for us, what was really important was the deep acknowledgement that health is underfunded. We all in this room, I think, have extreme privilege that we have healthcare, health insurance. We're sitting in a beautiful air-conditioned space, but so many of the people that we serve, that we're here to support, don't. And we need to change the paradigm of funding and where that money needs to go. And so one of the things that we did in partnership with the Green Climate Fund, the WHO, the Global Fund as well, was to create something called the Guiding Principles for Financing Climate and Health. For the recognition that we needed a rallying cry and a clear set of outcomes and opportunities that we needed to get policymakers to focus on to ensure that those who don't sit in the air conditioning of today have a chance at the opportunities that we do in this room. And so that's what we've been really focused on to be able to help drive to make sure that we close the $10 billion climate and health financing gap. And it's really through the work of Alan and the Wellcome Trust team to help us understand what are the evidence and policy solutions that need to happen. It's our NABA helping us understand what on the ground could that be, and how do we, and what do we fund? What do we need to do in terms of clean air? It's Dr. Zhang telling us how to use AI and how AI can help us accelerate those solutions for people. And so it is truly a P4 effort of trying to get money to places and people who are counting on us.
Thank you, Liz, and perfect segue also. So I would love to just turn to you, Zhang, to talk to us a little bit about how AI and climate and health, how that intersection is showing up. Kim-Hui gave us that challenge of connecting the dots, and we'd love you to kick us off in that thinking.
Thank you. Very happy to be here. This is a super critical issue. I want to emphasize climate and pollution are the single biggest risk to health. I mean, this is something that the world has not recognized before. But if you look at just the other diseases, whether it's cardiovascular disease, respiratory disease, communicable disease, or the direct cause of deaths, right, as our panelists mentioned before. It also, of course, has some consequence we never expect before. And I was made aware last year by a friend of mine that he's from Australia. They have a lot of big ocean areas, and the climate change, the heat, has a possibility of exposing the permafrost, right, which is never exposed before. Right? When that gets unleashed, you will see, obviously, a lot of the ancient virus, and also will be the methane, which is actually more poisonous than anything we have. There are a lot of things we had never realized before. So I think this is a commend the organizers for this session. So I want to talk about how we, more positive side, how we use technology to help some of these issues. Obviously, with big models and the generative AI, we, for the first time, were able to model the weather, the climate change in longer trajectory, in more accurate form. We can also play with the synthetic data with different extreme weathers, and also the linkage, the correlation with different health risks. And actually, we work with our Shanghai AI lab, and we built that model. We're still in the primitive form, but we seeing a lot of things we never seen before. The second thing, of course, in China, China has done a great job in terms of using renewable energy, electric vehicles, and it's world leader in all these areas. But in China, about 40% of the electricity is still produced by cows, right? And the number is getting lower, but still, there's a lot of emission. So what we are doing is, first of all, we are trying to make efficient use of data centers, lower the energy of data centers. I'm also the one to blame. The big model, generative AI, also use a lot of energy, a lot of electricity. Actually, right now, data center costs probably about 3% of the world energy. In 5 years, it's probably it's going to double. I just see a report from KPMG or McKinsey. I don't know the resource. By the end of the century, it's going to be 20% of the world energy, mainly electricity. So we have a responsibility to contain that. Right? So our model, we always use smaller parameters. We're not use a big model, contain big model, reinforcement learning primarily to reduce the data center energy by about 20 to 25%. Another major energy cost is communications, like 5Gs. 5G is fast, but it's not power efficient. Have so many different gateways, routers, and hotspots, and also using a technology called MEMA, which is not very efficient. It's communication efficient, but not power efficient. So we use, again, a lower cost AI algorithm that to make it more efficient. We deploy that in Tianjin, in quite a few cities in China. We lower the whole energy cost by about 15%. There are a number of other things we're doing to reduce just the energy costs, and also, of course, autonomous driving, a smart city is another project we embarked on. So, in summary, that it is critical. The climate is critical. The health is a huge risk, and the AI and the generative AI have an opportunity to help mitigate some of the risks.
Thank you so much. A really diverse and brilliant set of perspectives to kick us off. I would definitely encourage you all, please, to start thinking about your questions. I have one to start us off. Arnabda and Liz, I would love you to talk a little bit about equity. So we know through COVID that health inequities are exacerbated by crises. The climate crisis is a crisis. How would you recommend those of us in the room, wherever we are in the PPP space, to bake in equity in the start of our thinking? Arnabda, I think you've got some thoughts here. Liz, I'd love to hear how that's showing up in the financing principles and more broadly.
I think you can't have equity as a separate pillar. It is something that has to cut across all the interventions, starting with even how you analyze, right? It's not just what the answer is. It's how do you even understand the problem? So if you take, if I just took air quality again as an example, right? It is the outdoor worker, is the outdoor policeman, is the construction worker. They're the ones who are more exposed compared to us who can afford an air purifier at home. It's when you talk about clean cooking fuel, it has a gender-based inequity challenge. So equity has to be at the heart of it. But how do you then begin to solve? I'll give you a few examples. One of the things we've been working on with one of the poorest states in the east of the country, Jharkhand, is working with self-help groups, often run by women, in conducting focus group discussions to understand how do you expand the distributorships of cooking fuel cylinders. Because what's happened is energy subsidy reform has resulted in massive connections for clean cooking fuel, but the replacement of the cylinders takes a lot more time because there's no nearby distributorship where the household can go and purchase. So mapping that out at a hyperlocal level makes sure that the household, the poor household, is able to access clean cooking fuel. Another example, dispersed pollution sources. We've been working with the Delhi government. There are 13 hotspots for pollution, and we've been working with them to identify hundreds, if not thousands, of individual dispersed sources of pollution. So it's easy to see one big factory emitting smoke. It's much harder to figure out construction practices somewhere, waste burning somewhere else, etc. But that has a direct impact for the poor people around those neighborhoods. So that's the information then drives the war room that the government runs. One final example I'll give. It's in my pocket. This is a block of green brass, and we developed it with a tiny cluster of brass makers in one of the states in India. Brass melts at 1200 Celsius, and you often need really dirty coal to do it. But these are tiny enterprises that are not going to attract, let alone commercial funding. Even philanthropic funding is not going to reach them. So what we did was we worked with this cluster, designed a furnace that could melt brass for the first time in India at 1200 Celsius without using coal, using cooking fuel, 55% lower emissions. Now, why is this an equity issue? Because these are really, really poor people working in really, really poor enterprises. But small enterprises like these are 40% of India's industrial backbone. But you clean up that industrial cluster, you clean up the ambient air. And now we've connected them to the largest non-banking financial institution called SIDBI that actually gives out loans to small businesses. So this is where the equity lens helps to get to solutions at scale, which has a climate benefit, a local air quality benefit, but also a jobs and growth benefit.
Thank you, Liz.
It's a great example. Just you carry that in your pocket. Cool. It says Cleaner Air and Better Health Project. I'll give it back to you. It's a really great and important question. One of the things that we did in terms of refreshing our health strategy was acknowledge that we needed to listen. And I think that we went out to a number of communities around the world to really try to understand what were they hearing and what did they need. And that really actually stemmed, Saleja, from our work in COVID, which I'm sure many of you remember the early days when you couldn't get a test and didn't know how you were feeling. And in our work in India in particular, that was a very acute challenge to our grantees there. And in the absence of what then became the antigen test, one of the missions that we were focused on as a foundation was we've just got to reopen the economy. How do we do that in a safe way to get people back to work? And it's an oldie but goodie, but one of the things that we realized was that the foundation had a long history of health infrastructure in Asia. One of our first grants was actually to create public health in Thailand, and also in China. PUMC is one of our earliest grantees in 1914. But what we also realized we funded were disease surveillance networks and data systems. And so as we did that, we started working with a community, one of the largest refugee communities in Bangladesh, in Cox's Bazar. And the technology that we deployed there and helped support the community with was wastewater surveillance. And let me tell you, wastewater surveillance in an informal settlement is not easy to figure out. However, through the work of numbers of grantees and people on the ground, we were able to both map the community and understand where those wastewater samples came from so that we could actually mobilize resources, tests, and other resources to those communities to keep them healthy and safe. And as we did that, we realized now that, once the pandemic and then the immediate threat had passed, that there were other opportunities to use those surveillance networks to start thinking about things like dengue. And I'm sure many of you have seen the news that is happening in Latin America, where mosquito and vector-borne diseases are on the rise. We are focused on helping support communities around the world. We're working in Brazil, we're working in Bangladesh, and in India in particular as well, for example, to start to help support data surveillance and help communities actually identify where the potential threats are. And for example, in Cox's Bazar, the work has actually enabled them to get 7 days of notice. And 7 days of notice to bring mosquito nets, to bring vaccines to a community that already has low resources is a game game changer. And so we're really, really excited about that and see that there's a lot of potential to be able to scale solutions like that. The other reason why that's important, and I say this as an ex-energy infrastructure banker, is if you can't measure it, you can't finance it. And so that ties up, Szilagyi, to the financing principles, because we felt that if we could actually understand where those threats are, we could help measure those threats, and then we might be able to help illustrate and provide that evidence case of what financing was needed. And so we're working to build out that ecosystem now, but it is a critical part of how we see our contribution to the fight against and the upscaling of climate and health.
Fantastic, thank you. One more question from me, and then we'll turn to the floor, so be ready, please. Alan, would love to hear from you about some of the strategies and approaches that Wellcome is taking. It can feel like the scale of the challenge is insurmountable, so how is that showing up in some of the work that we're doing, and what are we doing to kind of get into that space that can maybe encourage others? And I think an associated question for Zhang to be thinking about, with AI and the intersection with climate and health, where do you see the role of philanthropy? Where can philanthropies start to enter into that space to be a really kind of catalytic and supportive presence there? So I'll turn to Alan first.
Brilliant, thank you. Well, I mentioned research is the core to what we do, and let me tell you, we funded a lot of research. So Wellcome Trust has made a commitment to spend £1.5 billion a year on research, with a focus on health. And so in the climate team over the last year, we funded more than £40 million worth of projects here in Asia on things like the impact of extreme heat on maternal and child health, evaluating adaptations that can protect health from extreme heat, evaluating WASH adaptations in informal settlements, preparing health systems for the spread of infectious diseases. So a multiple range of different things, because again, it's so important that we generate the evidence that's needed. And there's still huge gaps in that evidence, as I mentioned earlier. And so that's one of the first things we'll do. The second thing we're keen to do is, can you raise your hands if you're from the health sector in this room? Okay, could you raise your hand if you're from the climate sector in this room? Oh, quite a nice spread. That's unusual. Normally, at these meetings, it's largely health people. But one of the things we're absolutely desperate to do is bring these two communities together. Yeah? So health people don't understand climate, with the greatest of respect. I'm a health person as well, it's very complicated. And climate people have, up until now, not really incorporated health into their thinking. So bringing these communities together is really critical. And we spend a lot of our time doing that convening. And we're hoping later this year to be announcing some major awards for centers of research and evidence on climate and health, regionally located. We're going to start in sub-Saharan Africa, and then we'll move to Asia as well. So, that's bringing these communities together, facilitating the opportunity for research at the intersection of climate change and health. And the third thing we realize is, of course, we must work together. We've got a large endowment. We're very fortunate to be able to spend a lot of money on research, but it's still a tiny amount compared to the need. And so, of course, to do that, we work with many, many partners. So I'm delighted to see Climate Leadership Initiative here, Climate Lead, here now with Robin. And we worked very closely with Climate Lead last year to identify pathways for philanthropy. What are the opportunities for philanthropy to contribute in this space? We worked very closely, Liz already mentioned it, at COP with multiple partners, including the Rockefeller, to really bring together a collaboration of partners, the World Health Organization, Rockefeller, the Gates Foundation, and others, to really bring health onto the agenda at COP for the first time. And then finally, also with Liz's team, we're thinking about the broader philanthropic collaboration and the funders network. So, there isn't time for us all to duplicate each other's efforts or to compete. We must work together. And so bringing together those partners in a way that we can share our experience and our plans and drive faster action. And that's, of course, partly why we're here now, to talk to funders and other philanthropies in the region. And we'd love to have more of those conversations if you're up for it. Thank you.
Thanks, Alan. Zhang, over to you.
I see philanthropy plays a very unique role in programs like this. Right? This is one of the things that's super critical, but not a thing that private companies would do in the short term, because lots of this don't generate immediate the profits. And the government have to work together, but it takes a long time. I think to be fair, in the last 10 years, 5 years, a lot of progress has been made, but still, it's relatively inefficient. I think PAs, Rockefellers, other nonprofit, philanthropic organizations can start things very quickly. Right? First, identify all the gaps, issues. To have meetings like this to bring people from different sectors together to make it aware. And the second, to fund some, doesn't have to be big, but some top researchers who actually doing research in these areas. And the third is probably pioneer some smaller scale engineering effort, right? Then actually can make some difference, just early stage. And then eventually, I think the government will be the main force to drive this. Private sectors will have products. But initially, I think the first P, we have 3P, 4P, the first P has a unique role to play. And that's why I'm very optimistic. I'm quite excited that there are difference we can make.
Fantastic. Thank you so much. I'd love to open it up to the floor for any questions. We'll take a few at a time if we have them. There should be a mic also. So please put your hand up, and please remember to just mention your name and your organization before your question. Thank you.
Thank you. Hi, my name is Mary Abdo. I'm managing director of an organization called the Center for Evidence and Implementation. I'm based here in Singapore. I was curious about whether you could talk about, I think it's not clear, I think, to all of us what some of the critical data and evidence gaps, particularly if we look at Southeast Asia, may be. So what don't we know? And where can philanthropy potentially support? So it's interesting to hear some of the work that you've talked about in terms of monitoring and some of the indices that are being put in place. And so what else don't we know that would be useful for us to collectively put our energy into?
Thanks, Mary. We'll take one more if there is one. Here, thank you. You could.
Hi, I'm Anita Neville from Golden Agri Resources. I'm an interloper, I feel, in this room. We're primarily integrated agribusiness focused on palm, operating in Indonesia. I really wanted to ask Alan, you mentioned about the high number of high temperature days affecting well-being in Asia. We operate a very manual kind of operation, and we are seeing extreme high temperature days, 45 degrees in parts of Malaysia, for example, and Indonesia and Kalimantan. And primarily we have a workforce of around 90,000 people who are working in the field. We don't understand this climate risk in our business well. We also operate several hundred health clinics as part of worker well-being. I guess my question is, would you like to spend some of your £40 million helping us to understand the risk associated with health and well-being for our workforce, keeping in mind that the palm workforce represents somewhere in the region of between 4 and 16 million people in Indonesia alone? I would consider that a very useful and important investment. Thanks.
Great. Maybe we can start with that one first, and then I'd love Alan. Yeah, Aaron Abdo's thoughts together on the first question we had from Mary. Go ahead, Alan.
Thank you very much. Thank you, Anita. That's a great question. I'll come to both of them. Thank you for your kind offer. No, but seriously, so heat is the, we don't talk about heat. You know, we talk about heat in a sort of context. Oh gosh, it's hot out there. But actually, it's killing people. It's killing vast numbers of people. It's going to increase increasingly number of people. It's of course going to affect the poorest people, the most vulnerable people. It's going to affect women. It's going to affect children in ways that, and it's going to have effects, long-term effects that we have no understanding of. So, for example, we know if we can tell you. I can look in the literature now, and I can tell you exactly what will happen to the health of a male Olympic athlete if you stick him in a heat chamber and expose him to 60 degrees temperature. I know exactly what's going to happen to that person, because we've done that study. Not me, it has been done. What a study to do, but it's been done, yeah? What has not been done is if you put a pregnant woman in that heat chamber, because of course you can't do that. But nature is doing that for us, and we don't know what's going to happen. We don't know the impact on the child, and we don't know the long-term impact on the mother. And potentially it's catastrophic. Yeah? So there's a huge, so heat is a really, really big issue. So number one, we need to understand heat much more. The impacts of heat on mental health. When it's hot, depression goes up, suicide goes up, and violence goes up. And there's really clear evidence on that. Why? Again, not a clue. So until you understand, number one, you have to understand the scale of the issue. Number two, you have to understand the pathway. Why does that happen? So that you can identify the solutions, so that you can plan the interventions. And here, in this case, obviously, it's going to be a huge amount of adaptation actions that are needed. So we heard about the city heat plans. Those are being rolled out. Most of them are not being evaluated, so we don't actually know whether they work. So we're funding huge amounts of research on evaluating adaptations to heat, because we need to know. There is a total absence of evidence. If you want absence of evidence, so it's a kind offer to support your project. We have an annual call, and this fits in exactly to that annual call. We fund 25 to 30 million pounds a year on, they're called the Climate Impacts Awards. We're doing it every year. Please look, you've just missed the deadline for this year, but please do consider, I look forward to your application for next year. But on the question of what are the areas, so huge amounts of areas on, mental health is a big issue, maternal and child health is a big issue. We know of the impacts on food security are complicated. The attribution science is also very complicated. Can you attribute undernutrition to climate change via food insecurity or to poverty? How do you attribute the excess levels of undernutrition because of climate change versus poverty and poor food systems? So attribution science is a big area of work that also needs to be done. And then this issue of how do we know whether adaptations work? Countries around the world, especially in low-income countries are rolling out adaptation actions in a total absence of evidence. There is almost no evidence to say which adaptations will protect health. And that's critical. So without that evidence, governments are really struggling to act.
Thank you. We're running out of minutes, but I would love to hear from all three of our panelists, actually. What would be your key kind of data evidence gap? What is the thing you are desperate to know to inform what you do next in this space? And then we'll close out from there.
Sure. Picking up on that question, I gave examples of extreme weather, extreme heat, and extreme pollution. So what's missing? Number one is that hyperlocal assessment. What is hyperlocal? If you take a climate model and it treats all of India as one blob, that's clearly it's not even local, it's not, let alone hyperlocal. But even a district could have, 3 million people or 5 million people, let alone a metropolitan city. So hyperlocal assessments of climate risks are often missing, which then results in what is called the protection gap. So if you have $260 billion of infrastructure getting damaged because of extreme weather, more than $125 billion of that has no insurance cover. You can't insure what you have not measured in the first place. So that's number one. The second thing that's really missing often is linking the physical extremity with what we call the sensitivity and the adaptive capacity. So what kind of economic activity happens in a particular area then matters whether heat is really a limited condition or just a nuisance, right? And then you link it to the adaptive capacity of the local administration. So it doesn't matter if a country has a certain amount of money in its fiscal budget, it's whether the local administration is able to respond. And the third thing, perhaps the most important thing that's missing, if we say climate is underfunded and health is underfunded, who funds? Of course, philanthropy can play a catalytic role. MDBs will play a bigger than catalytic role. But who's not yet convinced? It's the finance ministries. And it's linking these risks to what it means for the economy, what it means for your fiscal room, what it means for investments and other things. That's the conversation we need to have, and that requires a lot more research at a hyperlocal level, but which is then scaled up to the macroeconomic level.
Thanks.
Tough to follow you guys. Okay, so I think there's two things that I'm not a scientist, so which is why Alan is so critical to everything that we think about. I think one thing that my team has said to me, and I can't quite wrap my head around, is that 58% of infectious diseases will be aggravated by climate change. What does that even mean? I don't know what diseases they are. I don't know where they're coming from. I just don't have a sense of what and how to protect communities. So I think that's one thing that hopefully, Alan, you all are working on, and we can figure out how to partner on together. I think the second bit builds on what you had said, Arnaba. I mean, the economic cost of inaction is so sizable. I haven't yet seen the actual modeling of what that costs and whether that is the catalyst, as you said, Arnaba, to get finance and health ministers and other ministers to act together. But that is one piece of evidence that I think could both hopefully catalyze action, but also perhaps serve the opportunity to structure insurance products or other things around social impact bonds, et cetera, to be able to drive and fill that 2% and drive that 2% of climate and health financing much higher.
Thank you, Liz. Zhang?
Well, we need more data, right? Data.
Yes.
One, of course, is the heat. The other thing I understand is also the variance of weather, right? That actually resulting in a health problem and agricultural issues and all the other issues. It's ecosystem issues. It's the variance of the weather. So it would be great if we have concrete data. I know in a lot of data we only had in the last number of years. The weather data is only 100 years, so okay. But if we have those data, real, true data, right? Not anecdotal, but true data, that will help us build a more accurate model, and then we be able to iterate, right? Get feedback from the future events and make our model a lot better. But right now, the data we build model are very, very small, right? And a lot of time we synthesize, we generate the data, might not be very accurate. So with that, we will have a better understanding of weather and health, ecosystem, loss of productivity, economy. Yeah.
Thank you so much. We'll have to close out this panel now. We'll have another one to follow, so please don't go anywhere. But for now, a huge thank you to our wonderful speakers. So Alan, Arnabda, Liz, and Zhang, thank you so much for your time.
Hello, everyone. Welcome back. I hope you managed to get some refreshments, because the next part is going to be very exciting. As you heard, climate and health are extremely complex issues in and of themselves. So the intersection between them is even more complex. It's an all-hands-on-deck issue, as Bob rightfully mentioned. So let's see those who are actually sailing that ship with some practical solutions, today presented by 5 of our presenters into these 5 focus areas that we have been looking into. And the first one comes in the case of extreme weather events. So I'd like to invite Mr. Chang Liu, the CEO of Ask Health Asia, up on stage.
Thank you. Good afternoon, everyone. I'm Chang Liu. I'm the founder and CEO of Ask Health Asia. We are a think tank and a catalyst for health system transformation and life science industry development here across Asia. And we are also the lucky grantee that Lisa mentioned with Rockefeller Foundation that actually pushed us to embark the work in the intersection between climate change and health. So apart from the work in Ask Health, I was an adjunct professor, associate professor at Chinese University of Hong Kong. So since graduate school, I have been studying health systems and policy for now 18 years. And by last week, I have been climbing the learning curve of climate for 18 months. I think that's common for many of us, really trying to work across the bridge from our past profession to really go into the interconnection between the two disciplinaries. But I really believe that personal level learning is very critical because I think for me really to also learn what all the terms I'm talking about is very important. But certainly the cross-sectoral collaboration and joint learning like the event today is so critical. So I'm really honored to be here. So we all know that Asia is witnessing a growing intensity in climate change. So we all know that Asia is witnessing a growing intensity in climate change impacts, which are compounded with a series of extreme weather events such as heat waves, droughts, and flooding. And we also know that the impact of climate change actually deepen health disparities and disproportionately affecting the most vulnerable population. I think this is particularly true for the adverse health impact led by the extreme weather events. I think some of the speakers in the last session already described it. And I think since the extreme weather events are mostly low in odds, but maybe based on what Alan just shared, high in odds here in Asia, it yet can lead to catastrophic outcomes. So we observe here in Asia, a lot of the adaptation strategies actually are mostly focused on precaution-related measures. So this including early warning systems, insurance and other financial protection mechanisms, community planning, and also infrastructure and building design. So today, the case we are showing here is one of the 9 climate and health action cases we were studying and documenting from China last year with the support of the Rockefeller Foundation. So it's about a public health initiative to action for the heat wave-related health risk in China. So actually, this project started with a collaboration between the National Environmental Health Agency in China and the China CDC, and has gone through several phases to ensure both the national level planning and coordination, but also the local level testing and implementation. So I think it's a really interesting process that they did. They started with planning at the national level, and then also sort of in the same time design a few local pilots across different parts of Asia, and then generating evidence from those pilots that feed back into a national level again, the model design and also the sort of the framework refinements again at the national level. And that national level model then adapt again in the local level and also applied and also tested, evaluated in the local. So I think that whole process actually iterating continuously to be able to continuously fitting into the refinements of the model that at the national level, but also the actual sort of implementation programs in the local level. So, so we really like this program development because it's actually included the joint efforts between the central and the local governments. I think we really was exchange with Dr. Goh in the sort of the project that they're doing in India, and involved certainly the Plan, Do, Check, Act design. So, but certainly in reality, it might not work as perfectly as I was describing because it's really hard to coordinating in the national and the local level together. But at least this really prevented the situation which Mr. Blyer mentioned yesterday, that many times there's no action taken after the national strategy and direction set. So in this case, actually, there's continuous effort in the national level to ensure both a long-term sort of roadmap has been progressing and achieved in the whole nation level, but also very practically implementation at the cities level. And also we like this program because the system includes both identifying the warning signals as well as taking proactive and also targeted measures that based on the early warning signals as well. So besides the study in China, we also identified other interesting cases in Asia, such as leveraging innovative insurance product for heat wave in India, and also using AI and IoT solutions for flood management in Japan and Indonesia. However, most programs we observe in Asia are focusing on early warning and risk mitigations only, and for the extreme weather events, while the impact on physical and mental health haven't been systematically examined. And also in the meantime, we think there's still a lacking of connectivity between the early warning sort of system and project that they're developing with the actual healthcare delivery system and the community response system. I think that might be a role where philanthropy sector and the private sector can play. That's all for my sharing. Thank you.
Thank you so much, Chang. So I'd actually like to open the floor for some questions, and we haven't really taken use of our pigeonhole yet, so if you'd like to submit some questions, please do so. Otherwise, I'll open the floor. Are there some immediate questions that you would like to ask? Eagerly. Otherwise, I do have one. So, Chang, we're talking about these 5 different focus areas, right? And I was wondering what of the other focus areas that that you're actually working in within Health Asia. So is it beyond just extreme weather? Could you describe a bit about that?
Sure, thank you. I think actually the extreme weather case was a science task. So I was really also learning just now in the last few days to dive into that case, which we documented. So in fact, as a think tank, Ask Health Asia, we're really focusing on doing the systematic research on the nexus between climate change and health, and also doing the convening in bringing different sectors together. So over the last 2 years, again, we're just starting climbing the learning curve of this intersection area. We have been starting our research and study work in China, working with partners like Rockefeller Foundation and World Economic Forum. And we published 2 reports on climate change impact on health, mostly focused on leveraging precision public health tools for climate-sensitive diseases. And also we are sort of in the process in planning for our further study in other geographic areas in the region, such as Southeast Asia, and also potentially focus on more vulnerable population subgroups, such as young children, women, and also the elderly. And for the convening, actually, we have been doing rigorous sort of planning for the dialogues that cross-sectoral and cross-nation in the Asia region. So we did 2 sort of convening sessions last year, partnering again with the World Economic Forum and Rockefeller Foundation. And this year, actually, we're mapping out our convening. The next one is coming up next week in the closing ceremony of the first Shanghai Climate Week. So I don't know any of you know that Shanghai is actually launching their first Climate Week this year. So we're actually very honored to insert the topic of climate change and health in the closing ceremony for the Shanghai Climate Week. Maybe 2 more small points. One, I think we really like the analytic unit of a city or sort of a sub-region because it's still systematic in terms of the solution, but we feel it's not political. It's really pragmatic, can be very technical as well. So working on the city climate and health space, we're working now with partners like Resilient City Network, Yale University, and NYU in developing capacity building programs and toolkits for urban planners and city sort of governments in the Asia region as a focus for now. I think that's all the work we're doing.
Thank you so much. Any burning questions? Brilliant.
Hi. What kind of utility have you found for AI in studying this health-climate intersection, and especially in terms of prevention?
Because some of the cases we are documenting are in China and also other part of Asia. Actually, it's quite sort of prevalent in the case of adapting AI and other sort of digital technology and tools in the data analytics. Especially, I think, in the early warning system and some of the preventive sort of solutions, where I think a lot of the AI capability has been starting piloting and building. Thank you.
Brilliant. Thank you so much. Are there any more questions? I just have a very quick question, which I think is climate and health is a pretty niche topic. So how did you get into it personally?
Personally, I think actually we started. So I'm as a health system professor. We were actually focusing more on health financing and more health system topics, and we started partnering with Rockefeller Foundation for a lot of their projects in Asia and also in China. And we just starting to also work more in the global health space. And so in some of the global health dialogue, we're really starting to see more and more sort of intersection between climate and health. And also, certainly, I feel China as a very important sort of leader in climate space, which haven't been rigorously, I think, participating in the global dialogue on climate change and health. So I thought that might be our entry point in really dive into having our first report on this topic in China. And also, I think we're really fortunate to be able to partner with organizations like Rockefeller in this journey.
Amazing. Thank you so much. I'm very happy to hear that it's a topic that's coming more into focus. Thank you very much for your presentation.
Thank you very much.
Next up, we're looking into infectious and communicable diseases, specifically on mosquito-borne diseases and climate change. I would please welcome Dr. Ng Ching from the Group Director of Environmental Health Institute at the National Environment Agency in Singapore. Thank you so much.
Thanks. It's an honor to be here. I somewhat feel a bit out of place. It's going to go rather technical compared to what you have been discussing, but it's really a pleasure. So mosquito-borne, I come from NEA, Environment. In Singapore, dengue control is under the Environment Agency. So the question is, can we mitigate? We know the impact of climate change on mosquito-borne, and the question is, can we make a difference? This is Singapore. A view from, if you go to one of these tall buildings, you will see this. Very urbanized, you know that. And it really favors the proliferation of this mosquito, Aedes aegypti. My colleague is there. He's an entomologist. He knows everything about Aedes. So you can ask him if you want to. But basically, it loves the urban setting. Everything that we're built for ourselves, this mosquito is smart. It takes advantage of it. So with urbanization, with travel, with climate change, this is all going to exacerbate the problem of dengue or Zika that this mosquito transmits. So we're going to be dealing a bit on this because it is a very nasty mosquito, especially the females, because only the females bite. The males don't bite, okay? So it's going to be relevant later on. Singapore, this is the geographical spread of dengue along with Aedes aegypti mosquitoes. As the country gets more urbanized on the west side and the north side of Singapore, you get more invasion of the mosquitoes, and dengue goes along with it. All right, of course, with travel efficiency, people move around a lot and passing viruses around, so it can spread, and the dengue outbreak can be explosive. And we know that dengue transmission increases with warmer weather. So this is known. Besides having more mosquitoes, the virus replicates faster. So it's then able to transmit the virus more quickly or more efficiently. So Singapore is very small, with just 700 plus square kilometers. So what does it look like in a larger country? For example, Nepal, where I like to use Nepal as an example because of the topography, because of the climate. It's really representing the whole world, right? You've got the tropical, the temperate, and the cold weather. So in Nepal, you could really see Aedes aegypti and Aedes and the mosquito and the disease climbing mountains or climbing hills as time progresses. Since 2004 was the first time they discovered dengue and Aedes aegypti. And that was really in the Tara area, which is about 67 to 300 meters high, all right? Subsequently, they found it at Kathmandu, 1,400, and more recently, in a higher altitude of 2,100 meters. So literally, Aedes aegypti is climbing mountain. And this really represents what is going on in the world. I choose Nepal because of the variation in climate and the topology, and also because they have very fantastic surveillance data. So, but I think this represents the world, and especially Asia, which is a cradle for dengue. It is a cradle. We have been suffering from dengue for almost a decade, a century actually, almost 100 years. And this is a modeling that shows how dengue, Aedes aegypti is going to spread in Asia. This paper has got a global picture, but I'm just choosing Asia because it is going to be a challenging area, especially with more urbanization, more flights, and with climate change, it's going to really exacerbate dengue. So the question is, do we have a solution? As I mentioned, it's been more than 100 years that we've been suffering with no solutions, no drugs. Vaccine came about quite recently, but still with lots of limitation, no treatment, no good vector control tool. Until again, recently, we've got quite, I think, last 5 to 10 years, we've got new tools coming up, and we're excited about it. So this is one tool that we are using in Singapore. It's a project Wolbachia. Wolbachia mosquito, male mosquito, as I said, it was relevant. Male mosquito, between the gender, it's relevant here, because the male mosquito that carry Wolbachia, when he mates with a female that do not carry Wolbachia, the eggs do not hatch, the resulting eggs do not hatch. So if you keep releasing the male Wolbachia mosquitoes, you see a plunge in the mosquito population. So we have got very successful stories here. We release male mosquitoes because they don't bite, and when they mate, you cause a suppression of the population. Tomorrow you will probably, if you attend the next meeting tomorrow, there's going to be one on dengue. I think that's another approach of using Wolbachia, all right? So this is our approach, which is for suppression. Currently, we cover about 30% of all households in Singapore. That's about 480,000 homes. In our preliminary calculation, we have up to 77% reduction in dengue cases in areas with these releases. And it's not possible without sort of approval or acceptance by the public, by the community. So we do lots of surveys, and we found 96% of them had no issues with it. They either accept or neutral. All right, so that's very encouraging. This is the eraser effect of the Aedes aegypti population in Singapore. More than 90% reduction in Aedes aegypti population in areas that we have been to. This is the rolling carpet approach, where the blue area shows you where we are released, and the bigger the area as you roll out, you just see the Aedes aegypti being cleaned up. Okay, this is earlier results. And today we have 8 other sites. Again, we see cleaning up of the Aedes aegypti population. So this is very encouraging, and I think today it's really exciting for us because of technologies such as this, that I think there is hope for dengue, of mitigating dengue. Next, another approach, another new approach that we have got into is the use of wastewater surveillance. I think Elizabeth just this morning mentioned, or this afternoon mentioned, about the wastewater for dengue. We haven't been successful in detecting dengue in wastewater, but with Zika, we have got lots of success. Zika is excreted through the urine, so it's a good diagnostic. In fact, urine is a good diagnostic sample. So in this, we have published this, how we use environmental surveillance to complement clinical surveillance and using wastewater and mosquito testing. More recently, Zika, this is a newspaper, this is our media, where we detected Zika in wastewater in an area, and we alerted the public based on wastewater signals, wastewater and mosquito signals, telling us that there could be Zika transmitting in the area. It is very important for Zika because Zika is very mild. Most cases will go undetected. However, it is very critical for pregnant women to know that there are Zika around because of the neonatal issues that babies could be affected. You could get microcephaly or other conditions in a newborn. Okay? Now, this is made possible. We've got quite a lot of work going on. I just want to focus on the Wolbachia and the wastewater, but this is really possible because of the cross-sector collaboration that we have. I'm from the National Environment Agency, and we work very closely with the health agency, so this is part of our One Health grouping. We have other groupings, the water group, the parks and parks, and food agency that forms the One Health. And working with private companies such as Orino Technologies, NM3 Technology, these are local SME, and Verily, which is an MNC under the Alphabet Group, right? Yeah. So we also work very closely with academia. Just now there was a mention of how important academic, I agree, I do totally agree. We work very closely with local and international partners. And of course the IAEA and World Health Organization as well. And I guess because here we're talking about philanthropic, I need to highlight that we work very closely with Temasek Life Science, which is under the Temasek Foundation in Singapore. Okay, that's all. And I think this really wrap up the importance of collaborations across sectors. Government, we always have had a 3P, which is people, people, private, and public. But I think today we will be adding, we have got a fourth P in it. All right, thank you.
Thank you so much. You're completely right. We do need that fourth P involved. Any questions? Oh, brilliant. Oh, I think there's one here in the front. Thank you.
Thanks so much for the really insightful presentation. I'm wondering if under Project Wolbachia,
Yep.
you know, kind of if there's evidence showing it's working really well, what would you say is the impediment to expanding the project beyond 35% of Singapore? Kind of what are the key challenges between that and, say, all of Singapore being covered by this project? Thanks so much.
Yeah, thanks. Thanks for the question. It's important. My boss asked me a lot about that too. Basically, it is a very nascent technology. Every component, you want to produce mosquito, you need to think of the science, the engineering, the automation behind it. And that, we haven't got it. We haven't got it, the world hasn't got that kind of automation. It's not like brewery or whatever, right? So automation is important, and that's, for us, it's important that we integrate all these disciplines as well. Not just biology, but we have engineering, we have AI incorporated, and data analytics all incorporated to make it happen. So in overall, we are still developing a lot of this technology to make it more cost-effective. So as a nascent technology, it can get expensive. So the question is, how do we cut the cost? How can we reduce the cost of production and release? So I guess the more automated it is, the better it will be. Yep.
Very much. Oh, thank you. Unfortunately, we only have time for one question, so please do ask them afterwards. I'm sure they will be answered.
All right.
Thank you very much. Next up, we'll be looking at food and water security and quality. So I'd like to greet Professor Tony Wong, who's the Director of Partnerships at RISE, up on the stage.
Thank you and good afternoon. I just want to share a project that I'm involved in, which is really in the nexus of water quality, to some degree food, nutrition, really, and how that impacts on health and the influence of climate change in that. And the project that I want to talk about is really a project called RISE, Revitalizing Informal Settlements and Their Environment. It's a project funded by the Wellcome Trust, thank you, but also supported in a lot of the interventions by the Australian government, the New Zealand government, and the Fijian government in the project that we're doing. This gives you an example of the type of challenges that people living in informal settlements face every day. Even in the absence of climate change, you find that informal settlements are the intersection of all the possible stressors that they are exposed to that impacts on their health. Intuitively, we know that. However, what you can see here, for instance, are pictures whereby not only are these settlements subject to regular flooding, it is subject to regular in situ contamination because of poor sanitation, because of flooding from upstream that brings to those communities the type of pathogens and fecal contamination. And of course, because of their poor conditions and their poor access to their dwellings, people often have to wade through highly contaminated soil and water every day. The picture to the left gives you an example of the fact that many of these communities are subject to tidal flooding every day. some of those communities actually practice open defecation, and it really didn't matter where you go to defecate. The reality is that what the tide can do, what water can do, is distribute it evenly back to the community every time the tide comes through. So that was a challenge that we have, and of course, our focus when we first started this project was to reduce and interrupt the oral fecal contamination pathway that impacts on the health of those people. Now, those pathways are significantly exacerbated with climate change, whether it is increased rainfall, whether it is increased sea level rises, whether it is about the changing in the hydrology of those communities, they are disproportionately impacted. And of course, some of the key health outcomes, of course, are quite obvious. One of the key health effects of oral fecal contamination, in fact, is gastrointestinal diseases. And the simplest symptom that you see in a lot of children is really the bloating of their stomach. What it's telling us is that the gastrointestinal diseases actually reduce the capacity of your gut to actually assimilate and take nutrients. You can give them the most nutritious food, but if they are infected, you'll find that there is very little capacity for them to actually take on that. And the consequence of that, of course, is stunting, diarrhea, poor cognitive development. Now, for people that live in informal settlements, and some of them, they are 2-3 generations, it is an incredibly vicious cycle that it's a deep dive for them in terms of this vicious circle of disadvantage because of the environment that they live in. There are a whole bunch of other secondary effects as well. The poor drainage in those systems actually are significant habitats for disease factors as well. As you can see, some of those pictures are pictures of our site that we see. So some 5 years ago, we set out to basically work on interrupting the oral fecal contamination pathways in those communities. And because of the inhospitable conditions that many of the informal settlements are on, the interruption needs to occur simultaneously across many pathways. And it requires us to actually think about documenting the range of pathways and prioritizing where we would interrupt them. And every settlement is different. We need to interrupt them to basically address the issue of flooding. And when we can't do much about flooding from upstream, we need to ensure that those communities drain well at the end of a flood so that you do not have ponded water that is highly contaminated. We need to eliminate open defecation, but in eliminating that, we need to ensure that the sewage is safely managed. Many of these settlements do actually have some very rudimentary septic tanks and cesspool, but the fact is that the density of informal settlements mean that the environment has exhausted its capacity to assimilate the waste that's generated. And the result is environmental contamination that they are exposed to. Water quality, many people recreate in those waterways and they are contaminated. Wells are being contaminated because the soil is contaminated from poor sanitation. And of course, we aspire to actually look at how, in the process of our intervention, we create local enterprises for informal settlements through the creation of productive landscape, cash crop productions, such as the growing of flowers in the wastewater that we would treat. And with all of that, the Wellcome Trust challenged us to deliver the proof of concept of our intervention, and I'll talk about that. But in building up our interventions, we were very committed to ensuring community co-design in our work. We found that in working with our community, they have increased awareness of their exposure and vulnerability, and in itself built incredibly social resilience in understanding how they interact with the environment that they live in. We built demonstrations to actually show what are some of the interventions we have. And that is really important in engaging with government. Engaging with government for them to see what the interventions are and to reduce the skepticism that in slum communities, they're way too dense for any kind of interventions. And we have shown is in this picture here a demonstration that we brought a lot of our government partners to actually see what's been done in terms of how do we provide flood-free access to the community, how do we use that structure to build constructed wetlands that are used to treat the wastewater that we collect, how we use those tanks in the second images to collect the wastewater and then to be able to deliver that to the wetlands for treatment. And of course, with all of that, we have commenced our interventions, and this is largely funded by the Australian government, the New Zealand government, and the Fijian government. Wellcome Trust provided the funding for our research and our development of the interventions. The physical work in Makassar, there are 5 slum communities that we have close to completing our interventions. That is impacting on, at the moment, 350 households of about 1,700 inhabitants. At the same time, we are doing an intervention in Greater Suva. There are 6 communities, and construction just commenced about a month ago, impacting on 460 dwellings and about 2,600 inhabitants. Why did we choose the 2 sites? They represent the different biophysical conditions based on the Pacific Island informal settlements compared to an Asian city informal settlements, different planning rules, different cultural settings, and we needed to test all of those ambient conditions and test our interventions against those ambient conditions as well. And these are some of the pictures in Makassar whereby we were able to construct, if you like, in very tight spaces, wetlands that we can then use to actually treat a lot of the wastewater that we collect and remove their contamination from the site. We could see we built toilets to try and, when they do not have toilets, to eliminate open defecation. We built footpaths to ensure that if we can't do much about flooding, at least we can do is to provide good drainage at the end of a flood, whereby access to dwelling is free from exposure to the contamination from the flood water. And the latest innovation, the last picture to the right, we are now building modular wetlands, whereby hydraulically they may behave as one single wetland, but they are dispersed in the community, connected by hosts, such as they can then accommodate really tight spaces in informal settlements, but still promote the nature-based solutions that we have in managing the quality of that wastewater. Now, this is a very busy diagram, and I do not want you to worry too much about the fine print, other than to say that we set up to prove, to secure the proof of concept of our intervention. But the proof of concept is not just about the randomized control trial that we're doing under the instructions of the Wellcome Trust. There are needs for us, for instance, the proof of concept of our community engagement and community empowerment in co-design. We need to have the proof of concept of the constructability of our interventions with local labor, local knowledge, and very, very tight spaces. We need to have a proof of concept of the pathways between site contamination and the contaminations that we find in the stool samples and the blood samples of the children under 5 that we are monitoring. We use DNA genomic analysis to actually tie the relationship between fecal contamination we find on the soil and on the water, and what we see in the stool of children under 5. We also wanted to demonstrate fit-for-purpose design in our proof of concept, adaptable design to site context. Some sites are steep, subject to flooding from upstream, and some sites are flat, subject to flooding from tide, and also subject to poor drainage. So with all of that, you find that our work at the moment has got to the point whereby we have proof of concepts on all of those elements, and we continue to work as we are doing our interventions to complete our RCT work, and both in terms of RCT improving of environmental health and the RCT and improve human health, which of course is the holy grail in all of that. But the point I really wanted to make is that when we started this project, we wanted to convince all our funders, including the Wellcome Trust, to trust us that there are many, many stepping stones we need to get through to even get to the RCT. To this point now, we have shown that we can deliver that, and we are quietly confident that we will be able to have a positive results in our work. So where do we go from here in my last slide? With that proof of concept, we are now thinking about having experienced the work, being able to de-risk a lot of the interventions that are unknown to many of us when we first started, and then prepare for our upscaling readiness. Our upscaling readiness is really about where do we go in delivering the first generation of replications. And of course, the obvious place to go, if you think about it, is the two cities that we work in Makassar. In Makassar alone, there are 135 slum communities. We are currently working on 12. In the country of Fiji, there are 250 informal settlements, and we are working on 12. But in the process of working on that 12, we have built in-country capacity of our team to be able to assess the fecal-oral contamination pathway and to be able to prioritize our interventions. And we have worked with government in both countries whereby they are now familiar with our work. They are, in fact, our obvious starting points for upscaling. On that note, I'd just like to acknowledge our partners, our research partners. It's a team of over 160 researchers across 12 different disciplines, from engineering, urban design, medical science, social science, and so on. And of course, our funders, Wellcome Trust, right in the middle here, together with the Australian government, the New Zealand government, and the Fijian government. Thank you very much.
Thank you so much, Professor Wong. We've got time for one question. Anyone urgently would like to ask a question? Otherwise, we are short on time, so please feel free to ask the question afterwards at the reception, where you're all welcome, of course. Thank you so much. Next up, I'd like to invite Ms. Neera Nundi, who is the co-founder and partner of DESRA, who's going to be speaking about air quality. Thank you so much.
Thank you. So we're a different kind of a case study, and really when they asked us to share the case study on air pollution, we said let's sort of show a case study on collaboration and partnerships, because it's actually difficult to deliver only on one part of this and to be anchored in civil society. So I think just to share, DESRA means enlightened giving. It's a Sanskrit word. We are based in India and committed to India, and we're celebrating 25 years this year. But to be honest, really ventured into this climate space, embarrassingly enough, only 2 years ago. And there were a couple of triggers that helped us move into this. One being a very young team. We're 160 people, and you'll be amazed at how young people really want us to prioritize climate. But we started to hear from the community that they were actually experiencing the impact of climate and the crisis, and that the dialogue and the discourse in India around mitigation became very sensitive, and there was this division between mitigation and adaptation that we asked ourselves as DESRA, hey, it's the G20. We have young people who are very committed to this. We have a potentially open government that might be willing to listen if it's really based in building community resilience. And we had an Indian family, which is actually very rare, wanting to fund climate. So the Rain Matter Foundation, that has a family who are brothers, that started a brokerage online company called Zero that put $200 million into climate, and basically came to us because over the 25 years, we've been building collaboratives, pooled funds and platforms for ways to really solve at the intersection. And so we went to ask each other, we went to ask the community, as in we went to ask nonprofits, we went to ask civil society organizations, hey, what do you actually need in this climate space? And they said, well, we need to build community resilience. And we said, okay, well, what does that actually mean? And these are some of the areas that they sort of came up with, that could there be a way that we go cross-cutting? So although the funding ends up being education, health, and disaster, We have a Giving Pie network of about 300 families. 80% of them are Indian families. Majority of them fund education and health, and the third more common being disaster. That could there be a way that we look at the intersection of climate and here, and we could really see that with the research that we did with Observer Research Foundation. Then they came back and said, is there a way that we could collaborate and be a platform that consults with the government? And we found that the government, through our other collaboratives, was willing to hear and speak to groups of individuals and not one-on-one, especially civil society organizations, actually to hear how their policies and schemes might be working or not working. And then we also heard, help us with storytelling, help us to actually change this narrative, help us be on the right side of this climate narrative so that A, we can get funding, but B, we can actually be seen at the intersection. And finally, there's national, but there's also very much regional. So we sort of heard these 4 different areas, and that's really where we came up with this platform called Climate Rise, not to be confused with Professor Tony's Rise. They said, is it the same Rise? We're like, no, this is climate, resilience, being inclusive, sustainable, and equitable. And we asked ourselves as a group, if we come together, what can we do? And it was around collaboration, actually having these partnerships, changing the narrative, but also facilitating philanthropy to be able to move into this climate space. And we started to hear from this community of 100 different NGO leaders that these were the intersections that they wanted to prioritize. And you'll see cities as a unit of service delivery, livelihoods and agriculture within that, health systems, and really conservation and restoration. And so if you double click on this health systems, we really found here that it was heat stress and air pollution that started to emerge as the 2 themes. And in air pollution, see, what ends up happening is it's cross-cutting and it's really hard to structure this, but I wanted to share some of the stories of what we were hearing from the community around air pollution and what is it that civil society organizations can do. And really, it was about how are you strengthening the front line to build that community resilience. And an example is Mahila Housing Trust. So one way that we've structured this Climate Rise Alliance is we've actually made NGO leaders and founders the steering committee. So it is by civil society, for civil society kind of an alliance. But it is also a place where we wanted science, government, funders, and communities to actually be represented and engage with each other. You will be surprised that the climate space is an intimidating space. And it has largely been driven by the Global North funding, but also a European way of engaging, that it is very difficult for all this very important work to directly be connected to community and therefore to community resilience. So there's a growing need to actually build bridges in language for us to translate some of the science and the research to really what does it mean for the community. So you heard in the panel before sort of around data and evidence and how can it be more hyper-local. And so we keep saying hyper-local, but what we've seen in Climate Rise is an organization called Mahila Housing Trust actually has AQI ambassadors, although I don't know why they're called AQI ambassadors. These women end up being ambassadors for a whole bunch of other things in the community, but they have monitoring devices that they can use to be able to test and see which parts of their community are experiencing what kind of air quality. Now, these ambassadors, women from the community, are trained on a bunch of different things from obviously this monitoring, but also how to manage heat stress, also how to look at different kinds of diseases, but also how to protect their children and elderly. And interestingly enough, the question becomes, what do they do with this data? So they're actually using this data to try to connect back to a CEEW, who you heard Anurabha, his framework. That connection is actually difficult to make. So the framework, the common set of metrics, and how this modeling ultimately impacts which areas are impacting air quality are all the different kinds of moving pieces that need to come together. But what's critical that we've actually found is enabling frontline workers and communities to actually engage in solving some of these problems. In fact, we've seen the construction workers, some of these women are construction workers, they take these monitoring devices to the construction work sites, and then they'll see which days it's actually high in, and then they won't take their children to the construction sites. Or they'll really try and work in the community to convert chulas, which is like sort of fire burning ovens. So you see a lot of empowerment here, but we just believe that more needs to be done, and just building platforms and ensuring we have community at the center of it is really what Climate Rise is all about, that can solve or really help air pollution, but a lot of other issues related to climate. But I see this red staring at me, so I will end. Thank you.
Thank you so much. Neera, I would actually like that you stayed on stage, please, just for a couple of questions maybe here. Otherwise, I do have one for you. But I'd love to hear from you. Bob, please.
Thank you. Very interesting. And it's good to see that you're looking at both the twin impacts of air pollution and heat, which can magnify each other. What do people do when they, so for instance, if they've got monitoring and they see it's high air pollution or high heat stress, are there strategies in place of what they do, where do they go, how do they, because knowing that they've got high air pollution or heat stress is only helpful if they can do something to reduce their exposure.
So I think we're trying, so if Mahila Housing Trust specifically trains their women to actually go to the local government and share that data and actually aggregate it themselves, but also sort of within their community to use it just day to day. But I think that's the challenge, right? So they're collecting the data, they kind of behave on it and act on it immediately, but it's not really going other than to the local government. And there's a lot of hesitation actually to have that data and share it with local government in case it makes local government look bad, but also that therefore there might be a bunch of activities that are causing the air pollution for which there might be an underlying mafia of sorts. So there are a lot of sensitivities on how and what to share the data, but to be honest, all we've seen its impact right now is actually them feeling empowered to, in their most proximate way, use it. But there needs to be better ways to take that hyperlocal data, perhaps have an intermediary of sorts, or the NGO or Mahila Housing Trust, or the Climate Rise Alliance engage with that data with like a CEW, a think tank, or the government.
Great. Thank you so much, Neera. Next, we'll be hearing about demand signals from Mr. Basil Rodriguez, who is the Senior Regional Health Advisor for East Asia and Pacific at UNICEF. Thank you so much.
Thank you. And I know it's close to bedtime, so thank you for staying up. I'm going to swing it around to talk about children. Some of you will be going home to kids, so just to prepare you for your trip home. Many of us are here to share, but we're also here to listen and learn. And I want to thank those who organized these sessions. They're really, really informative. And I've taken quite a few bits and pieces, and I hope that we can connect and see how we can begin to share, because none of us as individuals will make the journey. So let's see how we can work together. Why are we here? I think we're here to understand how we can make the biggest impact on the things that we're describing. And the way to do that, I hope, as I said before, is that we can find ways to work better together, or at least to get to know what each other is doing. 2-3 years ago, this meeting was not possible. We have short memories, but 3 years ago, we couldn't sit in a room together. We couldn't shake hands. And here we are today with an opportunity to see how we can begin to listen to each other and learn. We also said with the pandemic that we try to build better health systems, having learned lessons about how we failed globally, as society, as individuals, and that we try to find ways to make everything work a bit better by sharing what we know. We're keenly aware at UNICEF that the key to shaping a future really relies on us finding ways to build more sustainable systems that benefit children, who we often say and must say is a way forward for all of us, right? The good news. While the world reduced mortality, you might have seen that the world celebrated last month significant reduction in mortality of children. it's been years and years in making, and I think we should all celebrate. Even as we talk about new challenges, let's celebrate what we've been able to accomplish. Globally, 56% reduction. In this region, East Asian Pacific, 81% reduction in mortality. That's a huge leap. So even as we talk about the gloom and doom, let's celebrate the things that are working. We're also aware that the issues around vaccines, the rollout of malaria, UNICEF is going to be working in this field to help to roll out malaria vaccines. And this is another area that I think, not just here in Asia, but globally, that we'll see quite a bit of impact. And these achievements aren't just about us, it's about all of us, right? We're simply a conduit that makes some of these things happen, but it's this partnership that I hope that we see is the point of importance. I want to talk about electrification of health facilities. Energy, I think Professor Tony's slide just now gave a visual image of the kinds of environment in which people still live today. When we think about innovation technology, we talk about the ways in which we can now do MRI scans in an instant, but there are populations that don't even have electricity. And at UNICEF, we'd like to think of ourselves as going beyond the urban into the rural to those who are disadvantaged. The idea that we can now use, we talk about heat, but we can take that very same sunshine and sunlight into energy, that energy into electrifying health facilities. That supports life, that supports services off the grid. And this is possible, and it's happening today. And we'd like to see ways in which we can begin to expand that, because it also impacts lives of everyone around us. So investing in these programs through UNICEF, what you see is this multiplication because of our large footprint across the region and globally, and that we can find ways to partner in the things that you're talking about with the things that we ourselves are doing on the ground. But there's a bad side to it, right? And the bad side to this is we are, in fact, even as we contribute to health, we are also contributing to the pollution. So there are ways in which we can now find to reduce this burden, both in terms of the issues around greenhouse gases, but also around air pollution. And you've already heard in presentations this afternoon that there are other efforts afoot, and I think this combination of efforts will allow all of us to see benefits over time. So I'm here to say, just keep the hope going. It's really going to be possible. The infrastructure to deliver these services will benefit from climate-smart solutions, the things that we're discussing here yesterday, today, and tomorrow. And those solutions are evolving even as we speak. If we can harness those in unison, you'll see the efforts. And if we come back here for this conversation 12 months from now, I'm sure you'll have a lot more that you'll see that, maybe it was born out of these discussions, and some of them evolved from other partnerships. Investing where people live impacts migration. When we concern ourselves about urbanization and investments and the burden, let's say, on tertiary facilities, if we invest in facilities where individuals are able to at least receive services where they live and work, it reduces that movement of people and reduces that exchange, right? We're not saying to stop this movement, but it's a way to ensure that everyone has access to services that they need. We are committed to low carbon and green sustainable health systems, as I've mentioned before. These work towards goals to reduce not just the gas emissions, but also inclusive and operate in harmony with surrounding nature. So this is a way to find that we ourselves, not just again as UNICEF, but as communities, can find a way to shift some of this burden and contribute to more positive outcomes. We're working to support governments with electrification of primary healthcare facilities, and the consequences of poorly equipped health facilities has impact, as I said before, on lives. So in a non-linear way, by doing the things that we're describing, you'll see the impact eventually on people's lives and hopefully on the environment as well. For us, in this region, we're spread across 27 countries, down to tiny islands in the Pacific, with a staff strength about 1,400, quite significant, covering areas around health, nutrition, education, social policy, social services, and so on. And this workforce is one that we're using to ensure that we can find ways to benefit not just individuals, but also communities and governments. The threat that we describe is actually quite real, but the opportunities to avert climate disaster rest in our hands. And if we continue to share the things that we've talked about, again, as I said before, through adapting, through rebuilding, improving, regeneration, reengineering, these are ways that we'll begin to see some of those results. I just want to close out simply by saying that I started by talking about the importance of children. And there is significant return on investment when we work with, for, and support children. So I'd like to implore all of us to use this opportunity. I hope that we can network, not just here, but beyond, in ways that we can together celebrate life, but also look at ways that we can begin to build some of the solutions that would help populations moving forward. With that, thank you so much for your time.
Thank you very much, Basil. Again, I would like to open up for some questions, whether there are some. Any pressing? Good that I have one then.
You have one, that's right.
Yes. So aside from solarization, are there any, in your opinion, other options to make healthcare facilities in Asia sustainable?
Well, I didn't get into details, but there are issues around even use of biomass. There are other opportunities, other ways that we can look at natural solutions to solve the problems. In some of these, we talk issues around financing, right? So we can go into other areas about sustainability. But I think the key is looking at strengthening communities. It's not just about the outside coming in to support communities. It's about the communities themselves learning, doing, and building their own resilient systems. So it's this transfer of knowledge. I mean, pretty much what we're doing in this room today. We're sharing information, sharing know-how, empowering individuals to make some of those decisions. If the dependence is on the outside, we're not discussing sustainability. So there are ways in which they can begin to build more resilient systems and depend on themselves.
Thank you so much.
Hi, everyone. Thank you so much for joining us at this afternoon's partner event. I know it's way past your bedtime and you'd all like to go back to your children. So I'll make this short and I will close with a brief reflection. We've heard that climate change presents a fundamental threat to human health. It affects the physical environment, with rising global temperatures leading to extreme weather events that impact millions. The acceleration of climate change will intensify weather hazards, magnifying its negative impacts on human health. We're already experiencing this firsthand and have fallen ill for the last several weeks already with the rising temperatures in Singapore, not helped by the temperatures indoors, as most of you know. And so tackling this systemic problem requires systems-level change to achieve sustainable impact. As we've all heard many times over the last 2 days, PPPs, philanthropic public-private partnerships, will be pivotal in addressing climate and nature challenges. This is consistent with the findings from our climate philanthropy report done in collaboration with our friends GAEA and ClimateWorks Foundation. The consensus among stakeholders was that achieving successful PPPs requires an alignment on a systems thinking strategy, active collaboration, and the adoption of innovative financing approaches, all while putting people and talent development at the core. The World Health Organization has said that climate change is the single greatest threat to humanity. Now we need governments, corporates, and philanthropic organizations to band together to fight back. Whether it's managing the consequences of extreme weather events, ensuring the quality of food, water, and air, or mitigating the threats to mental health, fetal development, and widespread diseases, we all have a part to play in effecting positive change. Once again, thank you all for making the time to join us at PAS. My deepest thanks and appreciation to our distinguished speakers and to our friends at WEF for spearheading today's enriching discussion. Thank you.
So you have had all a very busy day, right? We have served you some alcohol for those of you who drink, right? So please grab a drink if you have not had one. The food is ready, but it is a distance away. So before you get to the reception and the networking, we thought we'll just spend some time with two thought leaders. Right, we didn't want to lose the opportunity to have President of the World Economic Forum, who's also my boss, Borge Brenda, share some thoughts, as well as Ravi Menon, whom many of you would know. He has recently stepped down as Managing Director of the Monetary Authority of Singapore, but has been unretired to take on a much bigger role as a climate envoy, right, and also as special advisor to the National Climate Change Secretariat. I thought it was very good news because he's known to be a finance guru, and given that we always talk about the trillions needed to support the climate-nature transitions, right, that contribution would be very valuable to the conversations that's ongoing right now. So maybe I could take this opportunity to invite the two gentlemen on stage, so that I can start off the fireside chat. I will also give you a chance to ask questions. And for those of you who are still standing, if you want to take a seat, please feel free to sit in this table, because the two guys will spend the rest of the time here until the reception hour. Yeah. Thank you. Please take a seat and welcome them. Yeah, thank you. Okay. This is unscripted, largely, right? And it's really, I wanted to use this time as a time for some reflections, right? Because Borge, other than being the president of the World Economic Forum, also looks at trade, geopolitical issues, right, at the World Economic Forum. And we know that this year is also a year of elections. Half the world is going into elections or has gone into elections, right? And a big question on everyone's mind is, can the climate momentum continue, or what will happen next 2025? And Ravi, right, I've mentioned, he's been in a financial space for a long time. He's also been the brainchild of initiatives like the FAST-P, which talks about how we can better mobilize finance for transitions, pathway forward. Right, and I wanted to use this opportunity for both of them to share some reflections. In fact, both of you were at COP last year, which was a very significant COP, right, in multiple ways. Maybe we can start off by having you share some reflections on COP last year, your perspectives for where things are, and where you would like it to head, right? You can keep it brief because I do have a quick follow-on question around that. Whoever wants to start, Ravi?
Well, thank you. Thanks, Borge and Kim Hui. Thanks for having me here and the opportunity to meet you. Lovely to see you again after so many years. So COP28, well, the annual COPs, they have a cycle, ups and downs. Sometimes the agenda is strong, sometimes achievements are strong, and sometimes not so. I think we should take a multi-year approach to seeing how this goes. And I think if you look at it from that perspective, there's been a series of building blocks. So that's the good part. There is, I think, a movement away from commitments to action, or rather plans to act, Action is still slower. The metric by which we should judge all of this is the final output, final outcome that is desired. By that token, we've not turned the corner yet. Global temperatures are still rising, 1.2 degrees Celsius above pre-industrial levels. Global greenhouse gas emissions are still rising. They have not peaked globally. So those two are strong reminders. And the third is that the volume of financing going into transition and green is still far short, on the order of $2 to $3 trillion from where it needs to be. And on current trajectories, we are going to get some climate change. We are already seeing climate change. So it's no longer a matter of debate. I think the question is, how fast is this going to accelerate? And I think at some point, and I hope sooner rather than later, the world is going to wake up. Look, this is real, this is happening, this is devastating livelihoods, and in some instances, tragically, lives as well. And just as with the COVID-19 pandemic, when crisis stares humanity in its face, hopefully there'll be a galvanization towards action. And I just will round off by saying some of the stuff at COP28 that was significant, which are key enablers for which Singapore wants to be a part of. One is the need for transition pathways, and if there's time, I'm very happy to come back to that. Two, the need for blended finance, and three, the need for carbon credits. These three are the key levers to get us to net zero. And I think on all three, there was fairly good momentum at COP28. I don't want to exaggerate it, but there is growing recognition, awareness, and early plans and programs put in place to advance these three items. But there's a long way more to go. We don't have enough blended finance structures. Our carbon credits globally are not working as well as they need to, and we don't have clarity on all the transition pathways contextualized to the region. So that's work in progress, work to be done. Happy to come back to that, but my quick takeaway on COP28.
Borge?
Share the mic. Thank you, and thank you also Kim Wei for introduction. She introduced me as her boss. I would say that you all heard about the tail wagging the dog, haven't you? But it's great to be here, and great also to have Ravi on the panel with your new responsibilities. Being head of climate as the climate ambassador is a very important position. On climate, it's possible to look at it and where we stand then after COP28 in Dubai. We can look at the glass half empty or half full. So let me start with a half full perspective, but unfortunately I also have to share shortly a half empty perspective. On the glass half full, the fact that the price of renewables has fallen to 1/10 on solar, 1/7 on wind in a decade, that was not expected. Most parts of the world now you can roll out renewables without any kind of subsidies. Of course, you have to balance the energy and the power system, but that's good news. Also, the COPs have been 2 steps forward and 1 back, especially since Paris. Before Paris, you could argue we were on a 4.2 degrees scenario track. After Paris, maybe around 3. After Glasgow, there are reasons to believe that we can be on the track around 2.2. That's not 1.5, but it's a lot better than 4.3. So that means that we have come away. We're increasingly also seeing more of a willingness to put money and invest. We're all talking about the price Maybe we need 2 to 3 trillion more. I think 3 is probably more adequate. If you want to go net zero by 2050, we have to restore also biodiversity and also rescue nature in general, and it's so closely interlinked with climate change. I think there is more willingness to now look at that the price of inaction far exceeds the price of action. But the money is not on the table yet. That will also be one of the focuses on COP29 in Azerbaijan, Baku, in a few months. More money needs to come on the table, and we have to internalize also the externalities more. On the positive side too, first time I went as a cabinet minister to a COP was in 2001 in Marrakesh. I don't know if anyone else was in Marrakesh in 2001. I was then a young minister for climate and environment of Norway, and it was all about text negotiations. If we think it's polarized now, it was even more polarized back then, because there were also nations not really believing in the correlation between CO2 emissions and climate change. We are not there, at least not for the time being. So, and also what was interesting in Marrakesh in 2001, it was mainly negotiations in UN style. There were a few side events. Maybe there were 4 side events. When we went to the COP now, I think there was like thousands of side events. And what we're seeing in the private sector, what we're seeing also in philanthropy, what we're seeing also with civil society, it's just a revolution happening. And that's what we have to bet on for the future. The solutions is working together with governments, public sector, and philanthropy. So why is unfortunately the glass also, you can argue the glass is half empty, and Ravi just mentioned. Last year, we were supposed to be on track for 1.4 to reduce the global CO2 emission, greenhouse emissions to be more precise, with 7%. And we increased them by 1.5. That's 8.5% delta that shouldn't be there. And that's not acceptable. It really is not. And especially when we know that we are already paying the price. We see it on water, we see it on food production. We used to, when I made my first speeches on this more than 20 years ago, I was talking about, I think, grandchildren even, like we're doing this for our grandchildren. Well, maybe a little bit early for me to think about grandchildren back there then. But anyway, then we started to talk about our children, and now we're seeing it happening here and now. So this needs to change. In a polarized world, where it's harder and harder to reach any kind of deals, and especially in the Toxic Security Council at the UN, we will have to put pressure on the world leaders, and especially here I'm talking about China and the US. They have in the past shown that they are able to really also agree on something when it's important enough. And we saw that after the Second World War with the proliferation of nuclear weapons, and I think this is at the same scale in many ways. We just need the 2 largest economies to find deals here.
It's a good segue to my second question, and then I'll open the floor to invite you to comment as well. Every year, the World Economic Forum runs the annual risk survey. The annual risk survey. Right, and this year, right, 2 in 3 had a rather pessimistic outlook, which is that they expect the next 10 years to be marked by global upheavals or catastrophes. Right, last year we talked about the poly crisis, how different crises interrelate to create consequences much worse than each on their own can exert on themselves. And in times such as this, leadership matters. And in fact, there's a Chinese phrase to say, do the times make the heroes, or do the heroes create the times? Right? And I think this is probably a moment for heroes and heroines to step forward. And both of you are actually in leadership positions, influential and with the good expertise, well respected. And I wanted to just invite you to share with us your reflections on what you're prioritizing in terms of the resources you can harness, the networks that you are part of and you influence, to be that force for good. If we fast forward to 2025, right, and sitting on stage again, right, looking back, what would you have liked to have achieved in the next 1 year? And we know time is of the essence. I know, Ravi, this is a bit unfair because you just took on the role of climate envoy. But
yeah, no, it's okay.
Thinking about your priorities.
Those are very pertinent questions which everyone in this room ought to be reflecting deeply about, not only in this room, but everywhere. First off, I think trying to assess if there are more grounds for optimism or pessimism, end of the day, we'll never know, right? And I'm not sure that is the right approach to take. The right approach to take is regardless of what's going on in the larger geopolitical context and all that, and we have to try very hard to get people to come together. The key question is, what am I doing for my business? What am I doing for my institution? What am I doing for my country? Are they well positioned for the future, regardless of how that future is going to be turned out to be? I would say a fair assumption is that the world is going to face a very disorderly transition, because we've been kicking the can down the road. What it means that eventually to get to net zero by 2050, all of us are going to have to do quite a sharp reduction in emissions. Now, you think about the implications for that, for businesses, for economies, for societies, for demand patterns, consumption patterns, trade flows, investment flows. It's going to be huge. Some have described the coming transition as potentially as big as the Industrial Revolution, and we know how disruptive that was. And so the question is not, when will action be taken, how will action be taken? The world is going to go through a big adjustment because we've wasted quite a bit of time. Not entirely, we've made some good progress, but it's not enough. And if that transition is going to be dramatic, how are we going to be positioned for? What are the things we need to do? And the things we need to do for our own corporates, businesses, financial institutions, countries, and so on, is what's going to be good for the planet. They're consistent, right? What is not consistent is delaying action in the hope. And as Bodge just reminded us, the cost of inaction in every scenario exercise, and I've seen many of these, is far, far higher. Whether it's GDP impact on a country or revenue impact on a corporation. And people do not do stress tests enough. I don't know when the stress parameters will kick in, whether it's 5 or 10 years, but they will kick in. And so are we prepared? And so in terms of priorities, I think there are 3 key enablers and 3 key transitions that need to be made. And in a sense, that's how I look at my own role. The 3 key enablers are international in nature, and Singapore wants to be a part. We can't do this alone. We're just too small a country, like your country in a way, but I think small countries have a great gift of being neutral peacemakers, bringing other parties together in a non-threatening fashion, provide some thought leadership, and promote collective action so that the big players can lean in. And those 3 key enablers, as I said, transition pathways. Asia's transition is going to be key. There will not be net zero in 2050 if Asia doesn't get to net zero. Asia is half of global greenhouse gas emissions. 80% of Asia's primary energy consumption comes from fossil fuels. Energy demand in Asia is expected to rise to 2 times by 2050. So you put those 3, the math doesn't add up. Energy demand is rising so rapidly because of urbanization, providing electricity to villages. 45 million people in Southeast Asia do not have access to electricity. And that's a priority for national governments, to provide electricity. And the cheapest way to do it is fossil fuels, unfortunately. And many other coal plants, especially in Asia, long-term contracts. So that is going to be an uphill. So that is why we need transition pathways, how to wean that off. And you need to contextualize these sectoral pathways, whether it's for air transportation, maritime transportation, cement production, steel production, in a manner that does not compromise development, but achieves the decarbonization necessary in a way to reach the Paris Agreement goals. That cannot be compromised. So how do you do that? So that is why transition pathways are important. The other big problem, if I may elaborate on the financing gap, the cost of capital for a transition project, especially energy project, in Asia, in the emerging markets world, is about 2 times that in the advanced economies. And there are many reasons for this. One, there is a whole range of policy uncertainty and other risk factors, including foreign exchange risk, that heighten that cost of capital. You need to bring that cost of capital down. And second, you need to crowd in private capital. And this is another dilemma, because national governments, whether it's in the West or in the East, just don't have enough fiscal resources to meet the financing gap. You need to get private capital in and philanthropic capital in a synergistic fashion, in blended finance structures. So this was a big breakthrough, breakthrough in thinking and breakthrough in early efforts at COP28. We saw the proliferation of many such blended finance structures to try to make them work synergistically. Because when you bring in public capital in a concessional manner and philanthropic capital in a concessional manner, you lower the risk, lower the cost of capital. Private capital then is able to come in, and you provide technical assistance and project preparation. It de-risks further. Then you can make this work. And the third piece to make it work is carbon credits. We need to grow our carbon markets. We need to strengthen both the demand and supply side of these carbon credits so that they make the economics work for very difficult projects like early phase out of coal, for instance. 10, 15 years old. They have another 30 years of concession to run. That's revenue lost. So you need to generate carbon credits or transition credits for future reductions in CO2 and greenhouse gas emissions and bring that forward. Not easy issues, but we need to find financial structures to do that. So those three are 3 key enablers: blended finance, carbon credits, and transition pathways. And if you do that right for Asia, where I think the tensions and trade-offs are most acute between development and decarbonization, then I think it's pretty much easier in the rest of the world.
So I support all those points. When it comes to the World Economic Forum, one of our strengths, I think, is that we can mobilize the private sector. And we have shown that also in practice. So let me share a few examples to be concrete, maybe, and hopefully you know about those alliances or coalitions already. But before COP28, John Kerry, Secretary Kerry, and I sat down and we reflected on how can we really create a green demand that is not there today. Of course, if we have had a consensus on the CO2 tax globally, that would have created a green demand, because a lot of companies don't like to pay that CO2 tax, so then they use the money and invest in green technology instead of paying the tax. That would be ideal. That is like first page in any basic economic studies, is like internalizing the externalities. But that test we just flunk because there is no consensus around that. So what we said, if we bring then the large companies of the world into the same room, and we can have them also agreeing on using their purchasing power in hard-to-abate areas. So we got 90 companies in the same room, including Apple, including also Amazon, and big purchasers. So Apple committed then to say that 25% of the aluminum they use should be green aluminum. And the most aluminum producers like to sell to Apple. So they will then react to this demand and make sure that 25% of their aluminum is produced by renewables, because you need renewables for doing so. And it's totally possible. It's just that it's cheaper today to put up an aluminum plant close to a coal-fired plant that is maybe 25 years old and extremely ineffective. But still, you can earn money from that. That aluminum would then not be bought by that company. So then we did this for aluminum, we did it for steel, we've done it for fertilizers, we've done it for cement, we have no plans on aviation, we have it also on shipping. All these companies have taken on these kind of commitments, and hopefully that can accelerate also development of cost-effective green technologies. That's one way. Today, together with Tanya sitting here, another good colleague, in Dubai, GAEA, Tanya and I, in the run-up there, said we should replicate this also for land use, agriculture, and water. So today, I think I saw a few of you at the breakfast at 7:30, where we also know that land use agriculture is responsible for around 35% of all global greenhouse emissions. 80% of all global water use goes to agriculture, irrigation. We also know that deforestation, 70% comes from land use. What if those that are buying food and also is in this sector say, okay, we want the decoupling. We will buy your products when it comes to beef, if it comes to rice, if it comes to soya, we'll buy it, but you have to decouple this from deforestation, you have to get more crop per drop, you have to get beef that is more sustainable. If there is a demand for that, we will also see those changes. So that's the way I think the World Economic Forum can contribute. And we're looking at more and more sectors. And we are in a privileged situation. Of course, I'm totally biased, but we have 900 of the leading companies in the world as our partners. And we have, I think, like 67 on Fortune 100s, and we will push this. But there are also, as we know, some setbacks. You probably heard that the World Economic Forum is so woke. This is now said. We are woke. I'm not in this context ashamed of that, meaning that we are taking responsibilities for our planet, and we know. We do know at the World Economic Forum that we don't have any planet B. We just have this planet, and we have to deal with it as the planet we have. But there are obviously no people on X and etc. That believe that we can just continue to kick the can down the road with much higher prices and huge impact on health, water, and all we have discussed. And I think this is also what we're now faced with for the first time since I started to engage in these questions 25 years ago. I'm seeing also some setbacks, saying, oh yeah, we know it's there, but we have other issues that are also extremely important. But I think we need to deal with this energy triangle that also Ravi alluded to. Access to energy. There are still 700 million people that don't have access to electricity. There is an energy security question. Ask us in Europe. Everyone thought we were going to freeze and not have electricity after Putin turned off the gas, but we're doing pretty well, you know. We of course could do better because our prices are a bit higher than in the US and we see some deindustrialization, but we are comeback kids in the sense that when people then really start to care about where the steel, how the steel is produced or aluminum is produced, I tell you, our aluminum is much greener than a lot of other aluminum, so maybe there will be a time for that too. But on a more serious note then, we have to then combine also this with the decoupling. We really need to make sure that this triangle, it is there, but we have to take major steps. And as Ravi said, let's address the elephant in the room. And the elephant in the room is coal. And it's not only that coal emits a lot of CO2, but it's also a fact that we are using more on subsidizing. And this is, I think, is pretty crazy. We're using more of taxpayers' money in subsidizing fossil fuel today, so it gets even more cheaper, so it's more competitive than hydro or nuclear or renewables, new renewables, than we're using on investing in decarbonization. Then the glass is not half empty, it's empty on that one, I have to say. So that needs to change immediately. All subsidies that incentivize more use and making that is most polluting more cheap, it is, let me find the diplomatic word, not common sense.
Thank you. We have time for one question. Does anyone? Yes, the lady in green. And then, unfortunately, we'll have to adjourn to the reception so you can get to know each other as well. Yeah.
Vibrant spring yellow was the topic upstairs. So today and yesterday on different floors, here we've heard a lot of talk about voluntary carbon markets and credits, not so much talk about cap and trading mechanisms such as the European ETSI, proven to reduce emissions within defined territories at least. But let me come to voluntary carbon credits. Last time I checked, the prognosis was that we could create maybe 20 gigatons worth of those by 2050 under very favorable conditions, yet we keep pushing more than 50 gigatons of emissions per year. So my question really is, for the best impact on the world, who should be buying all these voluntary carbon credits? Because today, it's mostly the fossil fuel industry and airlines who keep buying those, many of which have been flagged for greenwashing.
You mentioned it.
Oh, yeah. So I wish there was a solution to reach net zero without carbon credits because of all the problems you've mentioned. The markets are fragmented. The prices are not uniform across markets. There are serious questions about the integrity of many of these carbon credits that are on the market today. Generating carbon credits that meet high standards is a great challenge. There are deficiencies in both the demand and supply side. And as you said, most of the demand is coming from high emitters who need to use these credits to offset those emissions. And whether that in turn is leading to an outcome where they don't have enough incentive to actually decarbonize first and meet the residual hard-to-abate emissions through credits, which is essentially the approach Singapore is taking, which is to abate as much as possible and then to leave open the option for buying credits. And we're gradually increasing those credit purchases. But globally, you're right. I think there needs to be a much stronger carbon market. At COP28, this was recognized quite a bit, especially the voluntary carbon credits markets, and to establish stronger standards and oversight of these. Now, a word about greenwashing. We cannot let the perfect be the enemy of the good. There is a lot of imperfection in the carbon credit markets. There is a lot of imperfection in how emissions are measured, especially Scope 3 emissions. There is a lot of uncertainty about how exactly the trajectory of emissions reductions are going to be achieved. Now, carbon credits pricing depends on all these things. Like all assets, pricing is never fully efficient. It is based on incomplete information and asymmetric information, and prices need to adjust. So I'm obviously not making an excuse for greenwashing, but I think if we pounce on every instance of inadequate reporting or faulty disclosure or erroneous assumptions used in pricing some of these things, we are actually having the opposite effect of people caping away. Already you hear instances in the United States for fear of litigation, companies not wanting to disclose carbon footprint. Now, without measurement, how do you actually determine what is a transition pathway and how to reduce it? Carbon credits are facing the same problem. So we need an approach which requires high standards, but actually is willing to acknowledge that there are imperfections in the market. We're not going to get there in one shot. And I think if there are genuine mistakes made, and we're going to see a growth in certification services, we're going to see a growth in ratings, and so on. There is a movement towards stronger ratings methodologies, carbon crediting methodologies, and I think those are things we need to put a lot of effort. And Bog's point about this is where it is important to bring the private and public and philanthropic or people sectors together. We need a partnership approach. We need to bring expert views. So if you give one example, transition credits generated in the managed phase out of coal, we've been talking to the International Energy Agency to look at those methodologies. We speak to Vera, Gold Standard, and other rating agencies to come on board what we call a coalition to study transition credits. How can we make them credible? Bring all the stakeholders into the room. You want this thing to work, but we don't trust the system is working. What can we do collectively to make it work? What are the standards we should insist on? And then apply it to projects, pilot projects. So we've got to take this step by step. We're not going to get there in one go. But I think that there is no alternative as one of the solutions that we need to build strong carbon credit markets.
Thank you, Ravi. That was very well put. It's time for the reception. Please join me in thanking Ravi as well as Boge on stage. Thank you.